Also being issued today, an executive order to amplify reporting from our medical providers. We want detailed information about COVID-19 patients, including how many are in ICU beds. Next, preventing further community spread from other states or regions with widespread COVID-19. The CDC recently issued travel advisories for anyone coming from New York tri-state area. My third executive order today requires anyone flying into Arizona from Connecticut, New Jersey, or New York to self-quarantine for 14 days, and our Department of Health Services will be working with airports to make sure travelers are made aware of these requirements upon arrival. And finally, more help for our small businesses and local restaurants. Many restaurants have unused commodities, food and otherwise, that could be sold to generate more revenue, to pay the bills, and help with payroll. My first executive order today provides flexibility on packaging and labeling rules to give restaurants the ability to sell additional goods to the public. And please patronize your local restaurants. Get takeout or delivery and be as generous as possible in tipping your service workers. Once again, Arizona is grateful for every individual and organization that is working, partnering, and sacrificing to help others during this time. What I mentioned here today only touches on the surface. As Dr. Anthony Fauci with the NIH alluded to over the weekend, the social distancing measures we have implemented are making an impact. We need everyone to keep it up, and I want to thank everyone for their cooperation and responsible behavior. Next, I want to hand it over to Dr. Kara Christ for a public health update. Doctor?
Thank you, Governor, and good afternoon, everyone. Today, I'd like to provide you with an update on the latest information about our cases, testing, preparedness planning, and the latest executive orders issued by Governor Ducey. To date, in Arizona, there have been 2,575 cases of COVID-19 in all 15 counties, and tragically, 73 Arizonans have lost their lives to this disease. With widespread transmission, we know that there have likely been and currently are more cases in our community. Across the country, we're learning more about the disease and how it impacts the health of Americans. While some cases are asymptomatic, we know the devastating risk that it poses to our high-risk individuals, primarily our elderly community. Across the country, we continue to see a shortage in testing supplies, from swabs to testing reagents, and Arizona is no exception. To date, 33,375 tests have been administered in Arizona. This is a 73% increase from the 19,271 total tests administered a week ago today. While we've made great progress, testing supplies remain in short supply. I'm hoping that as the supply chain strengthens, we will be able to administer tests to get every Arizonan who wants one results. But as of now, we must continue to prioritize those tests to the most high-risk Arizonans and those on our front lines, our first responders and our healthcare providers. Remember that testing will not change your treatment, but it can provide certainty for those first responders and healthcare providers who continue to be in high demand as cases increase. We continue to build capacity within our healthcare system, working closely with local county health officials and our hospitals and healthcare systems. Today, Arizona has 16,905 hospital beds and 1,532 ICU licensed beds. We will continue to provide updates on our work with the Army Corps of Engineers and Arizona National Guard to build out our bed capacity. While modeling shows promise in terms of projected cases, we continue to plan for the worst case scenario, ensuring that every Arizonan has access to adequate care in the event of a surging demand, and that includes ventilators. Using our new enhanced surveillance data, we're tracking the health of our healthcare system. Our hospitals are currently using 64% of the state's ICU capacity. 68% of the medical surgical beds, and 25% of the state's ventilators. That's 393 ventilators in use as of this morning, and that's primarily treating needs outside of COVID-19 cases. But we have an additional 1,152 ventilators available. We've dedicated $10 million from the Public Health Emergency Fund to provide funding to hospitals for the purchase of additional ventilators. Given this investment and the additional information that we've acquired through our enhanced surveillance, the updated modeling, and regarding our current ventilator capacity, we have amended our request to the Health and Human Services for just 340 ventilators. We've taken delivery of the state's portion of the Strategic National Stockpile, but we've committed an additional $9.1 million towards procuring additional PPE. This includes an agreement with Honeywell to produce over 6 million N95 masks for the state of Arizona over the next 12 months. And thanks to the generosity of the Ben and Catherine Ivey Foundation, we've directed an additional $5 million towards PPE. Their donation to ArizonaTogether.org will allow us to purchase additional high-demand resources like masks and gowns that our healthcare providers urgently need. I'm very grateful for Governor Ducey's leadership and prioritization of public health, from school closures to prohibiting dine-in services at restaurants and the closure of bars, movie theaters, and gyms, to the stay home, stay healthy, stay connected order. The governor has acted responsibly at the right times and has used public health as a guide. 2 of the governor's executive orders are directly informed by guidance from the Centers for Disease Control and Prevention and move Arizona another step forward in mitigating the spread of COVID-19. The first order is an order protecting vulnerable residents at nursing care institutions, intermediate care facilities for individuals with intellectual disabilities, medical group homes, and residential care facilities, including assisted living facilities. We know that our elderly and those with underlying health conditions are the most vulnerable to severe COVID-19. This order ensures that the staff at these facilities come to work healthy and they use PPE appropriately, and that confirmed and potentially suspected cases are cohorted and isolated from other residents. And if facilities suspend visitation, it requires them to establish electronic visual form of communication in lieu of face-to-face visits for residents. This is really important for all residents, but especially for those at end of life or receiving hospice care. The second order requires travelers from areas with cases of COVID-19, including New York, New Jersey, and Connecticut, to self-quarantine for 14 days. We know how quickly this disease spreads. This order will help to mitigate the spread of this highly contagious disease. And in addition, today the governor issued an executive order that updates and allows us to collect additional enhanced surveillance data to be reported to the department, including intubations completed per day, the number of COVID-19 positive patients in the hospital, the number of COVID-19 positive patients in the ICU, the number of COVID-19 patients in the emergency department, and the number of COVID-19 patients who are discharged from their facility. This data will allow us to better prepare for our peak in cases and hospital demand, and it will help us identify a better recovery rate for Arizonans infected by this disease. Today marks 1 week since the governor's stay home, stay healthy, stay connected order. It's very important that we prioritize the physical distance but engage in social connectedness. While these are difficult times, more than ever, it's important to be kind, passionate, and supportive of our fellow COVID-19 cases. Finally, you asked for additional information on confirmed cases within Arizona, and beginning Sunday, website to release information on confirmed cases with enhanced patient information. New tabs contain information on supplies distributed around the state and our enhanced surveillance data. Thank you. I'll now turn it back over to Governor Ducey.
Thank you very much, Dr. Christ. Next, I want to say that we're very grateful to Tom Betlach for agreeing to come back and lead the Department of Economic Security during the crisis. Director Betlach is a true public servant who loves Arizona, and he brings decades of experience in state government, including navigating through the Great Recession. I've asked him here today to give us the latest on his team efforts around unemployment and social services. Director Betlach.
Thank you, Governor. Thank you, Governor. The Department of Economic Security, or DES, is responsible for overseeing a number of different programs. Today, we're going to focus largely on the unemployment insurance program and provide an update in terms of all the efforts the department is taking and working around the clock to deal with an unprecedented demand